All right, we're live. Hi, everyone. Welcome to Talking Live with Macy. I believe we're going to wait for about 15 people before we officially begin. For those of you who are first timers, that's how we usually start for Talking Live with Macy. We usually wait for about 15 people to join the stream so that I know that there are people watching before I begin and continue on with the session. So I hope that there are no issues with you guys joining now. I see 7 of you already. Today's topic is very, very important, especially for females, for ladies. I know a lot of you texted me, so I hope you guys are joining today's session because it is a lockdown here in Malaysia. There's not much going on. I hope you guys are not gallivanting around. So let's wait for about 4 more people to join before we begin. It looks like there is a notification from my page for those of you who want to be a part of the stream. It looks like we have 15 people already. So, hi everyone. Once again, welcome to Talking Live with Macy. Thank you so much for joining and tuning in today. So, this is a PSA for all of you. If you have female friends, your wife, your daughter, anybody, females who would like to join in today, please share this stream with them right now because we have an expert that they can ask questions. And it's a very important topic. So I believe I saw all of you about 1 month ago on December 20th. And a lot has changed in Malaysia since then. We are now in MCO 2.0, which is somewhat like a lockdown here in Malaysia. So I hope that all of you are practicing your SOPs, practicing social distancing, so we can flatten the curve, not burden the frontliners, and businesses can start moving again. I really hope so for all of you. So remember, guys, now is the time to share this stream with people, with your friends, with your family, because we want them to come and ask questions, especially the ladies out there. This is a very, very important topic in conjunction with Cervical Cancer Awareness Month. So today I'm going to share with you a little bit of statistics on cervical cancer. So cervical cancer is the third most common cancer amongst Malaysian women. It is 41% of females that usually present at stage 3 and 4. This lowers their chances of survival. And 93% of cervical cancer is preventable. I would like to highlight that. 93% is preventable through vaccinations and regular screenings. One thing I've come to realize being involved in a cervical cancer campaign recently, last year, is that cervical cancer is a taboo here in Malaysia. It's one of the biggest cancers for females, but also one of the biggest taboos. Do you know why? Because what I heard, I was very incredulous, is that a lot of people think that women contract cervical cancer because they are promiscuous. And that's why families, friends, they shun women who have cervical cancer. And I'm here to actually share this with you. That is not true. And we should support cervical cancer patients and survivors the same as all other cancers. We should not shun them and we should support them. And today, we need to be educated about what cervical cancer really is and how to prevent it. So I'm really, really happy and glad that Prince Court Medical Center actually brought on an expert today to answer the questions that we have or you have about your cervix and also about cervical cancer. So thank you so much, Prince Court Medical Center. And now I would like to introduce one of our the expert from Prince Court Medical Center. She is a specialist in obstetrics and gynecology. Her name is Dr.Maiza from Prince Court Medical Center. So thank you so much, Prince Court, and also thank you, Dr. Maiza, for joining today's stream.
You're welcome. Nice meeting you. Hello, everyone.
Nice meeting you too. And to all of you, remember, stay back with us towards the end because that's when you can ask questions and Dr. Maiza will answer them. So, Dr. Maiza, once again, thank you. I would like to begin with the first question for today. My first question is, what is the role of a cervix for women?
Okay, this is a very, how to say, basic, but yet not many ladies out there knows about their cervix, right? So everyone knows about uterus because this is when you get pregnant, and this is the magical place where the baby will actually stay inside. But very hardly you really want to know about cervix, all right? So you can't really see your cervix, not like seeing your nose, right? So this is a model that we actually cut into half, right, of your uterus. This is uterus or your womb basically, and your cervix is actually the neck of the womb, all right, at the base of the uterus. Okay, it's a continuation. Okay, this is actually act as a gatekeeper. As you can see, this is your vagina. Okay, this is our vagina, all right, quite lengthy, around 8 to 9. Can you see that? Oh, this, okay, eight
Yep.
to nine centimeter. Yeah, and this is actually the cervix. Okay, so it acts as a gatekeeper to actually prevent infection from ascending up to the womb, to the uterus, all right, and then goes into the fallopian tube later on in life if a chronic infection that can actually cause probably fertility issues, you know. So the function of the cervix starts from the early in life, basically, you know, when you are teenagers, it acts as a gatekeeper to prevent infection, ascending infection. And later on, when you are in the reproductive age group, where you wishes to be mom basically, so it can give you clues whether you are in a fertile period or not. So it can actually releases some what we call liquid or discharge, which is sperm friendly, and that is one of the clue that you are actually ovulating. This is during the reproductive age group, and later on, you know, when you become pregnant, and this is the so-called the door for the baby to come out from the womb, from the uterus, and enter into the internal os and the external os, then come out through the vagina. So it is very important organ basically, but we tend to, how to say, forget, okay, that we have this such important organ. And women, they rarely want to actually go to see gynecologist or any doctor basically to screen for cervical cancer. Okay, this is the highlight, the main highlight of today's discussion, right?
Yes. Thank you so much, Dr. Maiza, for showing us the female reproductive system
Yeah.
and our cervix. I didn't know that it was actually there. So now, the next question is, there are stigmas associated with cervical cancer, as I mentioned, such as women
Yeah,
being promiscuous. Only promiscuous women develop cervical cancer. That's what people think. It's such a misperception. And I know that is not
exactly.
true. So, can you share
Yeah,
with
that
us how a person actually develops cervical cancer?
So that is actually one of the risks of developing cervical cancer. As you know, the main culprit that actually brings about cervical cancer is infection, human papilloma virus infection, which is HPV. All right, then it is why we are promoting all these young ladies, what do you call that? Girls in early 13 years, as early as 13 years old, to get a vaccination. So one of it is actually, yeah, sexual promiscuity. That means you have multiple sexual partners. That is only one of the risks to develop cervical cancer. There are other risks. For example, having how to say, giving birth at very early age, like 17 years old, and then you have multiple deliveries. Basically, you have a lot of babies. You know, maybe more than 3, 4, 5 babies. That put you as one of the risks of developing cervical cancer. And not to forget, if you are in a family where you have your mother or probably your maternal aunt, which is a direct relation with you having cervical cancer, this is also among the risks that you can or potentially develop cervical cancer later on in life. Okay, not to forget, one of the other, how to say, interesting relationship with contraception. Okay, that means the contraceptive pills. If you use the contraceptive pills more than 10 years, that means when you are using contraceptive pills for a long duration, there will definitely be multiple sexual contact. Okay, therefore it put you at high risk to develop cervical cancer. Right, these are among the risks. So you can't really say that, you know, these girls are naughty and therefore you develop cervical cancer. So we need to, how to say, get that out from our thoughts, basically don't misjudge a patient. All right, and most of them, although the peak, if you see the peak of getting cervical cancer around 30 years onwards, but most of the time it's between 59 to about 69 years old. This is the time when we detect a woman with cervical cancer.
I see. Okay, so
Right,
it's
yeah.
more for the older age group. So, are
Yes,
there
exactly.
many women in Malaysia who develop cervical cancer?
If you look at the statistic, we have this, our government, we have this CPGs, managing cervical cancer. All right, from this report, uh, you'll be like seeing the number one in terms of, we talk about ethnicity, all right, like Indians, they have about 10 ladies in 100,000 developing cervical cancer, and then followed by Chinese, okay, about 9.5 in 100,000 women. And the third in the row is actually Malay, 5.3. I mean, five ladies out of 100,000 women will actually develop cervical cancer later on in life. Cervical cancer is not one day off kind of disease. It actually it takes about more than 5 to 10 years time. When you are infected with HPV, then only it actually later on can grow, how to say, develop into cervical cancer.
I see. Thank you so much. So, ladies, I know you guys have questions. I believe you can start putting your questions in for Dr. Maiza so she can pick them up in just about a few minutes. I have just a few more questions. So, please put in your questions now so that Dr. Maiza can answer them. And if you have friends who want to know more about HPV vaccinations, about cervical cancer, or more about their cervix, please tag them in this show so they can join in. So my next question, Dr. Maiza, is what are HPV vaccinations?
So in Malaysia, if you look at our government program, basically it has actually landed somewhere in 2007, but we only make it into a policy for our schoolgirl, 13 years old, to get the vaccination somewhere around July 2010. All right, there's a school program. Even LPPKN is also supporting it. So for those who did not get vaccination, there were time where we actually advocate them to get HPV vaccination to prevent them from getting HPV infection and later on develop into cervical cancer. And it's actually for free, last time, until up to, if I'm not mistaken, 2019. All right, so HPV basically the vaccine, you have at the moment three types. You have bivalent, quadrivalent, and also nanovalent. Nanovalent, it covers for 9 subtype of the HPV variant. Bivalent means two type, and quadrivalent is four types. So there are various, at the moment in Malaysia, we have three types. All right. So it's supposed to actually boost up your antibody, where when you get this injection, it's not actually a live virus. Okay, it's a attenuated vaccine. All right, so it actually boosts up your antibody to protect you from getting HPV infection. That's how it actually prevents. So HPV is meant to prevent. It's not a treatment for cervical cancer. This is the thing that we need to highlight. All right, so on top of having HPV vaccination, the other important thing that we need to highlight during this discussion is screening. All right, it should goes together, the screening and also the prevention with HPV vaccination. All right, so if you talk about screening, okay, I know, I do understand not many ladies will actually come to me or any other gynecologist and open up their private part, especially those time, these are the only way where you can get a sample from do you remember the one that I showed just now? You want to get the sample from the cervix here. All right, so you need to put a speculum, what we call, we always talk as if it shapes like a duck mouth, mulut itik they call
Yeah.
it. All right, so yeah, and we need to insert that instrument into the vagina to open up. Then only we can visualize the cervix. All right, then we take the sample. Okay, those were the time where we need to do that. But nowadays, with there's another program, we call it ROSE program, where you can actually do a self sampling. You just
Yeah.
insert it's something like a cotton bud. Have you seen that? Yeah, it's like a
Yeah,
cotton bud.
I'm going to do that. I actually just
Oh,
received
you're
the
gonna do that?
certificate. Yeah, I'm
I
going
thought
to do
you've done
that.
it.
I no,
So
I
that
use
one,
my regular pap smears, and then I just received this
yeah.
just to test out. I don't.
Yes. So it is actually available, but it's meant to detect HPV DNA. All right, basically that is for HPV screening. If you do a conventional pap smear, either a smear on a slide or a liquid-based cytology, that is meant to detect any cervical changes. You know, the cells changes, whether you detect CIN or you detect ascus or agus changes on the cervix. But if you add on with HPV tagging, so you would only need to screen yourself every 5 years. Okay, if you do the conventional pap smear, if you have a consecutive two normal pap smear, then you need to do it, repeat it every three yearly. Okay, this
Yeah,
is how we do our screening program.
I see. So, ladies, once every 5 years, HPV
Yeah, you choose.
screening. This is the self sampling kit. I'm gonna try it next week.
Exactly. Oh, this is another one. There's another. Is that from Rose program?
This is from
Is it?
Evelyn.
Oh, okay. Oh, so this is another one. Yeah.
Yeah. So, I mean, with technology, we have all these options available. So, the next
Exactly.
question is, how does HPV play a role in cervical cancer?
No, it is a virus basically. So everybody can just get it, you know, and sometimes you don't have any symptom at all. That's why I told you if you look at the diagram or the how to say the pathology, it takes about 5 to 10 years for it to turn the changes on the cervix into pre-cancerous lesion before it changed into cancer. So it will take the insult will take more than 5 years actually to develop into cervical cancer. So that's how it changes the cells. All right. So we need these two things. One is to screen early, and number two
Yes.
is to prevent yourself from getting the virus through the vaccination.
Yes, I agree. So, would you encourage all females then to do HPV vaccinations?
Definitely. Okay, of course, according to data, if you look at data, WHO data, and also the CDC data, they would definitely recommend HPV naive population. HPV naive population means those who are not exposed to any sexual encounter, you know, as young as 9 years old, even in certain country. But in our, how to say, protocol, the government provide a vaccine for 13 years old girls, right? And this vaccine is highly effective for those which has not encountered any sexual act. All right, no encounter. But for those who have, for example, married ladies, you know, they actually they ask quite a number. They ask quite a number of questions. Doctor, I'm already married. You know, I got few children. Do I need to take the vaccine? That's another issue because when you are more than 26 years old, you know, the efficacy is slightly reduced as compared to those naive population. But of course, for example, if you do a HPV screening and you're not detected of having any strain 611 or 1618, which is a high risk for developing cervical cancer, I think it's worth, you know, getting the vaccine of 2 to 3 doses, basically,
I
right?
see. So, my last question, actually, you already answered it as well. I mean, HPV
Okay.
vaccinations for women above 26. So,
Oh
your
yeah,
answer is that you would encourage it, right? Either
yeah.
ways.
Yes, I do encourage.
Okay. So, ladies and gentlemen out there, that was my last question. So now we're going to take questions from all of you. So please start putting your questions in now so that we don't have, uh, so we get to answer your questions. Okay. So Dr. Maiza, thank you so much for answering all my questions. Dr. Maiza is from Prince Court Medical Center. So thank you so much, Prince Court Medical Center, for bringing this awareness session to all the ladies out there. So. Um, I think there's a question from William, but then this is not related to cervical cancer. So, William, join the
Okay.
next session, next month's oncology session. We'll help you answer that
Okay.
question. Um, okay, so Vanessa asks, thanks for joining, Vanessa, by the way. How much does a screening and vaccination usually cost?
Ah, the cost. Yeah, I knew it. This will be among the question. If you go to government, you actually, you know, pay 5 ringgit for the registration, but otherwise the rest are free. All right, it's fully funded by the government. But if you go to private hospital, it depends whether you go to a clinic or you see a gynecologist. Of course, the range is between, I would say, let me see. All right, I got the number here. If you do the conventional one, that means the smear, not the liquid-based cytology, range probably around 40 to 50 ringgit. This is without HPV tagging, okay? That means you don't detect HPV really, right? And if you do a liquid-based cytology, it can range between 80 ringgit to 250 ringgit. Depends on which center that you go to, probably, all right? And if you tag with the HPV DNA test, it can come out up to 250 and 330 ringgit. These are the range.
I see.
Okay.
But for HPV vaccination, it's free at government
Uh,
hospital.
Government hospital is all for no. HPV vaccine is free for the school girl. All right.
I
For those
see.
beyond that, yeah, you need to go to the private clinic basically to get yourself vaccinated. So you have the bivalent, quadrivalent, and nanovalent. So the range is between, if I'm not mistaken, 550 ringgit for 3 doses. All right, and if you get the Gardasil 9, that means it covers for 9 variant of HPV. Yeah, that one is a little bit pricey, 1,350 ringgit. Okay, these are the
1,000.
range of the for 3 dose for three
I
doses.
see. Okay. Hope that answered your question, Vanessa. She also had the next question is from Karying Xiao. Is pap smear screening done every 2 years sufficient? Once every two
Okay,
years.
Okay, it's like this. If this is your first time doing it, so what we recommend is yearly for 2 times. So if 2 times normal, let's say last year and this year is normal, then you can repeat it every 3 years. All right. Some center or do advocate 3 yearly normal. Then I mean every year for 3 times. It's normal. Then only every 3 yearly.
I see. Okay. Thanks,
But
Dr.
for
Maiza.
HPV, yeah, if you compare the cervical smear as compared to HPV DNA testing, only 5 yearly. That's the
Okay.
difference if you do the pap smear and HPV.
Okay. Vanessa also had another question. What is the time frame for the vaccination from the start of the
Uh,
vaccination
so
until the end?
okay, so usually you need to take it within 6 months. So zero means the day that you get the first jab, the first dose, and then 2 months later. All right, and at the 6 months. So 0 to 6. Okay, it
Okay.
also depends on the brand basically. So the other one is 036. Okay, either which you need to complete it within the time span of 6 months. If you do miss the third dose, for example, because you got some fever, some URTI, some infection, so you need to postpone first, then you can get a how to say catch up dose later. All right, for the
Okay.
third dose, it's
Interesting.
okay. Yeah. So we
Okay.
call it catch up dose.
Catch up those. All right.
Yeah.
That's good to know. Thanks a lot, Vanessa, for your question. And this is good for all females who have not done their vaccination to know. So Kaisin asks, if someone tests positive for HPV 16, what action should she take if she tests positive for HPV 16?
Yeah, so if you only 16, for example, right? 16, and then usually when we do the HPV testing, detect one, you can still get your vaccination if you want because it still covers for the other strain like 6, 11, 18,
I see.
and for the nanovalent, 9 other subtype that if you want to take the vaccine, all right? But otherwise, it's a surveillance. Basically, we repeat back the sampling.
I
Okay.
see. So, Kaisin, do surveillance, continue to
Uh,
monitor, and also if you
yes.
have not taken a vaccine, go ahead and do it. Um, Hope that answered your question. And
But it
Jehan
doesn't mean
asked,
that you get the vaccine now, you're gonna get the cancer immediately. No, it doesn't go like that. It takes some time for it to develop into spinal cancer.
I see. Okay. So Jehan asked, hi Jehan, she has PCOS. She asked whether
Please
it's
go
safe to
ahead.
take the vaccine.
Okay, it's safe. It is safe.
Okay, so Jehan, please take it. And Kaisin also asked, what are the chances to get cancer if she tests positive for HPV 16?
Now, even if don't have HPV, you still at higher risk to get cancer because of the other risk factor. Remember, I told you earlier. All right. But if we have the high strain, for example, 611, 1618, the chances is there. That's why we need to screen. All right. I can't really quote how many percent, of course, but these are high risk HPVs
I see.
infection. All right. So it can go as high as 70, 80%, but surveillance is very important.
So, when Dr. Maiza mentioned surveillance to everyone who's watching, actually, please do your regular pap smears and also your HPV screening. I think that's very important. Now, you even have like self sampling kits, so you can do it on your
Yeah,
own.
this is very convenient.
Yeah, so please keep monitoring, Kaisin. I hope that you are aware of this and that you can also get your vaccination for the rest of the HPVs. So, Gimbi Yo asks, is screening for cervical cancer still necessary for women who are already in menopausal stage?
Okay, usually we screen up to 65 years old
Okay,
for cervical. Yeah, for the pap smear, we screen up to 65.
okay. Thanks a lot, Dr. Maiza. Boy Chan asks, if a person is a virgin, can she have HPV vaccination? Yes, the answer is yes, right?
Definitely. This is the what we call just now the naive HPV naive population. This is the target population actually to get the HPV vaccine.
Okay. And Dabandan asked, she took the HPV vaccination 10 years ago. Does she need to repeat it again?
Usually, if you completed the 3 dose, that is sufficient enough. Up till now, this is what the report by WHO and CDC is sufficient if you take the 3 doses.
For the rest of your
You don't
life,
need
right?
to, yeah, you don't need to repeat at the moment.
Okay. Thank you so much. And we have a last question from Miss Lin Teo. If we miss the HPV vaccination during high school period, is it still
Mm-hmm.
recommended to get the vaccine? Will it be effective getting the vaccine after the age of 24?
This is the question just now. If you take vaccine after 26 years old, right? If you're already,
Yeah.
like say, engaged into sexual activity, like I say just now, although you have engaged, okay, you are at risk already. But if you do yourself a screening and you are negative of HPV virus, basically, so I would recommend for you to take, you stick and take, all right, the HPV vaccination to actually protect yourself from the risk of getting cervical cancer.
Mhm. So, ladies, get screened and also get the HPV vaccination. Once you're tested negative,
Absolutely.
go for the HPV vaccination. And even if you're tested for one of the HPV virus, you can still get yourself protected for the rest. Remember the statistics 93% of cervical cancer is preventable through vaccinations and regular screening. It is very simple. I know it sounds very simple, but just discipline yourself and get it done. Um, we have, I believe, one last question from Mel C.
Okay.
She asks, what's the oldest age to get vaccinated? How old? What's the last, like,
How old?
yeah,
Okay, I think according to the CDC, if I'm not mistaken, between 26 up to 45 years old. 45 years old, yeah. But of course, the regulation, the how to say, the guideline changes, right? But up till now, if you're 26 up to 45, you still can get it. I think beyond that, even the cervical cancer screening is only up to 65. Then beyond that, maybe, yeah, it's not, how to say, cost effective even to get it. It would not have any, how to say, beneficial effect, right?
so 26 to 45 is, if
26,
you're within
45.
the age group, get it done.
Yeah.
So, ladies, thank you so much for joining us on today's session. If you feel that this can benefit your friends, your girlfriends, or a female that you know, your wife or anyone, please share this with them. The second episode of the cervical cancer series will be on January 31st. It will be a very special session because we're going to have it as a webinar style. I'll put it as an event on my Facebook page. Sign up for it, and you'll get the link for Microsoft Teams. You'll get to join, and that will be a very private space for everyone to ask more questions. So today's session was so informative. Thank you so much, Dr. Maiza from Prince Court Medical Center. Really appreciate
Thank
it.
you for having me.
Yeah, and thank you so much, Prince Court, for embarking on this cervical cancer awareness drive. Remember to join us for the final session on 31st of January. Catch it on events. Next week, I'll post it up. So next week, we're taking a break, and then we'll come back on January 31st for a webinar. One last question before we end. Vanessa asks, like, how's the procedure like booking an appointment with you, Dr. Maiza, in these times of COVID-19? I think that's a very valid
Okay.
question.
Yeah, so yeah, everyone is very how to say skeptical nowadays, right? To go out, you know, you have to take care of yourself. So you have to follow the SOP. Definitely make sure you don't have temperature. All right. To book actually it's just online, and for me or any other gynecologist, it's all online. Just click on PCMC website. Okay, you can book online, or you can direct call for appointment, or even WhatsApp. All right. And so once you get the appointment, you come on the scheduled date. You can even ask for a letter saying that you've got an appointment from our side actually. All right. And then the screen is still the same at down there at the lobby. Okay, we screen for your temperature and your symptoms basically, and then there you go. You just, you know, come up to sixth floor to see me and my other colleagues for appointment.
Okay, thank you so much, Vanessa. I hope you get to make your appointment soon. And to the rest of you ladies, get screen and prevent cervical cancer. All right. I just know some, I just found out someone who has a cousin who had cervical cancer, but she detected early, but she still had it. So I just want you guys to know it's out there and we should be aware and educated about it. Thank you so
Yeah,
much,
it's
Dr.
very
Maiza, for
real
Queen's Park.
actually.
Yeah,
Yeah,
it
thank
is
you for
scary.
having me.
Thank you,
Stay safe,
Dr. Maiza.
everyone.
Thank you, Queen's Court. Stay safe, everyone. See you in 2 weeks' time for those joining the webinar. Thank you.
Thank
Bye.
you. Bye. Take care.
Take care. Thanks, Dr. Maiza.